Hi, everybody. Welcome. It's Michael Quirke here, and I want to talk with you today about CPTSD versus BPD and what sets them apart. Now, one of the trickiest aspects of mental health care is the overlap of symptoms that can occur. Many mental health disorders, despite being quite different, can display very similar signs. So, for example, as we're about to talk about, complex post traumatic stress disorder, or CPTSD, and borderline personality disorder, BPD, are actually very distinct conditions, and they can be and often are mistaken for one another. On top of this, CPTSD and BPD often go together. They're what we call comorbid. Such a scenario needs our full attention. If you're working with somebody in therapy, then your clinician must identify which condition you have and or if both are present. Um, Sometimes it's also helpful in terms of treatment planning to know which occurred first. With this in mind, let's explore some of the similarities and talk about some of the differences between CPTSD and BPD. So we'll talk about CPTSD basics right now. Most of you are probably familiar with trauma and with post traumatic stress disorder. Those are terms that are in popular usage. Complex trauma, however, is different in some very fundamental ways. In general, PTSD results from exposure to one single traumatic experience. So it could be a car accident, a robbery, an assault, uh, a natural disaster. CPTSD, on the other hand, arises from an ongoing series of traumatic events. So, for example, I've worked with clients who have had physical abuse, sexual abuse, domestic violence, emotional abuse. Many of the people I've worked with have experienced physical and or emotional neglect and abandonment. Sometimes CPTSD arises from being a child who was compelled to take on the role of an adult in one's family. There are also more extreme conditions like I've worked with people who were kidnapped, very sadly, or who grew up living in an active war zone. I've also worked with people and seen how human trafficking or being prostituted or even tortured can result in complex post traumatic stress disorder. A complex trauma survivor might show signs that are similar to PTSD. So, those could be things like intrusive thoughts, flashbacks, avoidance of anything that might be triggering uh, to the brain, then the nervous system, or hypervigilance. In addition, these common symptoms include things like dissociation, the inability to regulate your emotions, trauma bonding with the people who have hurt you or going on to form trauma bonds and dysfunctional relationships. It can also result in losing a sense of meaning in life. Now let's talk a little bit about some BPD basics. A hallmark of borderline personality disorder is having what we call an unstable sense of self. That means you're confused, you're conflicted, you don't know who you are. And sometimes this can be quite extreme, like CPTSD. This can arise from past trauma, but We do know that there are other factors that are more related to genetics. So, for example, depending upon the study that you read, about two-thirds, half to two-thirds, again, depending upon the research that we're talking about half to two-thirds of people who present with borderline personality disorder do have or have had experiences of childhood trauma, but that leaves about 30 to 50% who have not. So we do think that there's a lot of genetic and biological factors at play. And in fact, BPD specialists, I was talking to one recently, um, referred to BPD as a biologically induced emotional dysregulation disorder. Again, that's one point of view on the topic, but it's an important one. So BPD can also be a result of being a child in an unreliable or inconsistent caregiving circumstance. So if that's you, then you can be at higher risk of being diagnosed with BPD. When we talk about BPD symptoms, they include impulsiveness, frequent, intense, angry, antagonistic outbursts, fear of abandonment, a feeling of being empty inside. Also, it's very common that people with BPD do get involved in dysfunctional relationships. There is also a tendency for dissociation, especially if the person is undergoing a lot of chronic stress. Then that can really activate the dissociative tendencies. And as I mentioned, there's an inability to regulate emotions. Now, people with BPD often will engage in self-harm or they'll struggle with suicidal thoughts. Let's talk about some differences and also some similarities between BPD and CPTSD. Once again, these are distinct disorders that we're talking about. They're discrete from each other. They're different things. Their causes are different, and so are the treatment protocols. However, as I've been talking, you probably noticed that there is overlap in the lists that I went through. So let's have a look. Let's talk about relationship. Yes, relationships can be dysfunctional for both, but they're dysfunctional for different reasons. A person with BPD, despite the difficulties they're dealing with, is far more likely to seek close friendships and close relational partnerships. That said, these connections can suddenly be cut off when fear or anger is triggered. And with BPD, there is a tendency for what we call splitting, black and white thinking, very emotionally based thinking. A person is all good or all bad. There's not a lot of gray in the way that people with BPD see themselves and see other people, see the world and see life itself. An individual living with CPTSD is going to typically, they're going to rely more on avoidance and withdrawal from relationship. And that's because they've got a tough time trusting anyone because of what they've been through. So they're often going to choose isolation over community and over connection. Now let's talk about dissociation. This is a often counterproductive form of self-protection. More so for complex trauma survivors, dissociation serves to reduce the odds of reliving and re-experiencing the ugly events and their effects on you. If you've got CPTSD, you're already struggling probably with nightmares, with physical or emotional flashbacks. And so you might sometimes end up numbing out. Someone with BPD, however, often has dissociation that is similar in a way. It tamps down the feelings of stress and it quiets and it numbs out the distress that are very common and very chronic with borderline personality disorder. Now let's talk about emotional dysregulation. Once again, this is technically one of the symptoms that overlaps both conditions, but the approach is much different. Put simply, people with BPD, they do less regulation of their strong emotions, while complex trauma survivors are all about overregulation that is a very common trait in people with CPTSD. But you can see how either move can be unhelpful and dysfunctional and can hold you back in particular ways. Another area of difference is self-identity. And in fact, it's a key difference. As I've talked about above, people with BPD often have an unstable sense of self. They can almost feel like they are different people from day to day, or even from morning to afternoon. Conversely, somebody with CPTSD will almost always maintain a pretty strong sense of self-identity. They tend to have a pretty good sense of who they are. This demarcation can be very useful if you're a therapist or a mental health practitioner and you're trying to make a decent diagnosis. Let's talk about treatment approaches. Each disorder has some very particular protocols, while other approaches, they can be tried, they can be combined. For example, especially if you're dealing with comorbidity. So many of my complex post-traumatic stress disorder clients have gotten a lot out of the skills-based DBT approaches that are more common with DBT. DBT, for example, is a much more common treatment approach for people with BPD. Now, lastly, I want to say a word about the diagnostic jargon that I've been using. And I want you to know that I mean this in a helpful way. Here's what I find in my clinical practice. Diagnostic lingo affects people differently. Some people find it very helpful. They find it very relieving, very empowering. They feel much better when they have an accurate diagnosis because it tells them that what they're going through is not so rare, that there's a map, there's a way out, that other people deal with the same problems of life. But that's not the case for everybody. And I've seen this particularly with people with BPD. There's a whole bunch of people who are very alarmed and very disturbed and very upset by the term borderline personality disorder. And there's a reason for that. Often it's because it's been used pejoratively. There's no problem finding that in the media, on the internet, even in day-to-day life. It can sadly be common that people use diagnostic terms as slurs. They'll say, so-and-so is a narcissist, so-and-so is a borderline. So I just wanted to speak to that since that's particularly an issue for many of you who may have been diagnosed correctly or incorrectly with BPD. In closing, I want to thank you for watching. I want to invite you to like this video, to subscribe. I also want to invite you to comment if you'd like to share. I'd love to read what you wrote, and share this video. If you think it would be interesting or helpful to somebody in your life, pass it on. Thanks so much, and I hope you have a great day today.